We come to this, though. The Solidarity Fund has paid over 300 million rand this towards receiving a COVID-19 vaccine. It's been paid to the Covax program, which is set up by the World Health Organization to speed up the search for an effective vaccine. Well, there have been reports of mismanagement of the Solidarity Fund, but its deputy chair, that's Adrian Anthoven, insists all donations received have been used for the intended purposes. Well, he talks to us now this morning all the way from Johannesburg. Adrian, thank you so much for your time and good morning to you. Now, we'll get to some of the allegations around the mismanagement or not of those funds, but starting with the World Health Organization's Covax program, I mean, what's the latest there? I understand over 300 million has been earmarked, at least to be a part of the Covax program.
Yes, that's correct. So, I mean, from the fund's perspective, I mean, we see it's hugely important that we accelerate the rollout of vaccines in South Africa. I mean, that's the only way that the devastation that's been brought by COVID is going to end. And so the fund, we're very focused on looking at where we can play a catalytic role to accelerate the vaccines and the payment of the deposit. Government is obviously providing the guarantees for the bulk of the funding that will be required. The deposit will be for 15% of what's required for us to enter the Covax facility, and this will be to vaccinate 10% of our population.
And when we talk 10%, Adrian, this is roughly 6 million South Africans.
Correct.
Right. I mean, when we talk about the donation so far that the Solidarity Fund has received, I mean, in total, how much are we talking?
So the Solidarity Fund has received just under 3.2 billion rand. That is from over 2,700 South African companies, corporates, foundations, multinationals, over 300,000 individual South Africans from all over the country who've donated. So a phenomenal effort on the part of all of South Africa. And of that, roughly 2.7 billion rand has been committed. Obviously, not all of that has been spent at this stage. Has been committed to around 40 sub-projects and projects in the areas of health response, the humanitarian efforts, and our communication and behavioral change campaign.
I mean, with that being said, there have been concerns around the misappropriation of funds, especially in as far as, COVID-19 is concerned. We've seen some of the allegations on PPE contracts being awarded irregularly. What do you have to say in as far as the Solidarity Fund is concerned? Is every single penny accounted for?
Yeah, absolutely. And so, I'm really pleased that that we have the opportunity just to clear up this confusion. The Solidarity Fund is an entirely independent fund. I mean, we're not an arm of government. And so all of the reports that we've seen from the Auditor General and the Special Investigating Unit and so on have got nothing whatsoever to do with the Solidarity Fund. The Solidarity Fund is independently governed. We have, board and subcommittees. I mean, the very strongest governance standards at the fund. We have Old Mutual does all the fund administration. The program office is done by EY. We have, legal services. The ENS has a whole team of people doing all the legal services. We have internal auditors, SKX, external auditors for PwC. So we have and all of this, by the way, is pro bono. So every single contribution to the fund, over 200 individuals that worked for the fund pro bono. We have not spent a single cent on salaries, on expenses, on consultants, and we've had partnerships with entities to help us execute on our program. So all of the fund's procurement of PPE and medical equipment happened through Business for South Africa, which was a group of the top at procurement, logistics, supply chain professionals who came together in a pro bono entity at Business for South Africa to do the procurement on behalf of the Solidarity Fund. And there has been no mismanagement or misappropriation of funds in relation to the Solidarity Fund's procurement whatsoever.
Yeah, and with that being said, I mean, speaking of auditing, at least you're expecting at least that audit to take place in February, I understand, Adrian, where you say that you're proud that no investigations or at least any allegations against the Solidarity Fund have been found so far.
Yeah, absolutely. I mean, we have our year end is at the end of February. but there have been no issues at all in our procurement processes. And I think it's just very important for the public to understand that the fund is an independent entity. We work very closely with government, we work very closely with business and civil society, but we operate independently, and we take the governance and the responsibility that's been entrusted to us on the part of hundreds of thousands of South Africans very seriously, and have been absolutely kind of meticulous in ensuring that there's no mismanagement of funds.
All right. Putting that matter aside now, and before I let you go, just lastly, I mean, this second wave that the president is talking about, surely that should mean that Solidarity Fund's work does not stop. It continues. For the second phase, then, I mean, approximately how much are you planning on saving? And would you need more donations?
So at this stage, I mean, we'll have about, so moving into the second phase, we've had about 800 million rand remaining. Obviously, we've committed around 327 million rand of that to the Covax facility. So we have circa 500 million rand remaining. At this stage, we are focused very much on driving the behavioral change campaign. I mean, we know from the president's speech last night that it's critically important, the wearing of masks, physical distancing, and hygiene. These are really important behaviors that are needed to try to contain the infection rates and flatten the curve. And so this is going to be a huge focus for the fund over the next 6 to 12 months. We're obviously going to continue to focus on responding to some of the really critical humanitarian crises that we've been responding to around food security and gender-based violence in particular.
Right.
And then very targeted efforts in the health space. I mean, obviously what's required of the fund in the second phase in this next 6 to 12 months is going to be very different from the past, where we were very involved in PPE, essential medical services, huge support for the testing program, of getting CPAP machines out there. So we'll be much more targeted, I think, in this next phase, because also we have more limited resources.
Well, thank you so much, Adrian. We'll have to leave it at that, but thank you so much for joining us.